Hello, my name is Dr. Amy Patel, and we welcome you today to the second JACR Virtual Journal Club. I am the moderator this evening, or host. I'm the Associate Editor of Digital Media for the Journal of the American College of Radiology, and tonight we have a really great discussion with an expert group of panelists across all practice types to discuss burnout in radiology. How do we cope? This topic is very, very pertinent given what we are facing in radiology and in medicine in general, exacerbated by the COVID 19 pandemic. So, tonight, like I said, we will have some really fantastic panelists that will be a part of this wonderful hour. We ask that if you have any questions, please type the questions in the chat box, and we are very happy to answer them at the end or accordingly throughout the hour. So with that, let's introduce our esteemed panelists. All right, Dr. Slanetz, if you'd like to introduce yourself.
Sure. I'm Priscilla Slanetz. I'm a radiologist in Boston, and I've had a long-standing interest in wellness and burnout. Been in radiology for over almost 30 years now, and been running some residency programs as part of my career, and that's really where I see it's very, very critical that we deal with this problem that we're facing, because particularly in residency, I think people are very vulnerable to burnout. And we'll get into sort of why that is and sort of what the data actually shows in a few minutes. So thank you, Amy, for having me as part of this panel.
Thank you for accepting. Dr. Perry.
Yeah, my name is Hannah Perry. I'm the co-division chief and medical director of breast imaging at the University of Vermont Medical Center. And like Priscilla, I've been interested in burnout for many years, just kind of trying to understand what the implications are of burnout and kind of how this impacts the care we provide and the people who we are and our own mental and physical health. Yes. So I'm really glad to be here. Thanks for having me.
Thanks for being here. Dr. Ali.
Hi there. Thank you, Dr. Patel. My name's Kamran Ali. I'm in Wichita, Kansas. Been here for a long, long time, 18 years. We have I'm in a private practice, but we also have a community-based radiology program affiliated with the University of Kansas. And I agree with the other panelists. I think burnout is burnout and resiliency. There are big hot topics, not just with our residents, but with our colleagues as well, and with some of our support staff. So it'd be interesting to hear what everybody has to say tonight.
Thanks for being here. And Dr. Fishman.
Thanks so much, Amy. My name is Michael Fishman. I'm the section chief for breast imaging, also at Boston University Medical Center, BU, with Priscilla. And I'm also a certified health and wellness coach through Well Coaches. My interest in burnout really stemmed from personal experience as a junior physician, junior radiologist in private practice at the time, not really having the language to describe what I was feeling, which I later recognized was burnout. So coming to this with a little bit of personal experience and really happy to be here.
We're happy you're here as well and to share your expertise, and so interesting with the additional coaching, which we'll get into later. So with that, you've already sort of touched upon this. I think this is maybe a loaded question, but I think that everyone may have a slightly different or some sort of variable interpretation. But first of all, Priscilla, what do you think is the definition of burnout?
Right. Well, I think burnout, they define it as sort of mental and physical exhaustion. Yes, I think that is a component of burnout, but I think it's more probably also related to how you react to some environments that you're practicing in that cause you to feel very mentally and physically exhausted from your work. It's a loss of interest in things that you previously found joy in. And I think, the results of burnout, it makes it very hard for you to function at a high level and to provide the best care to our patients. So from my perspective, I think it's a combination of things, but it's partly how we react and respond to different situations you might be facing. And I think part of dealing with burnout is really building that resiliency, knowing how to sort of respond to those adverse environments or adverse stimuli so that you can actually learn how to function and process that much better and more effectively so you can provide better care.
Absolutely. Anyone else like to add to that definition?
No, I think that was a very good definition. I think burnout to me is also kind of along those same lines, a kind of a depersonalization. Like, what am I doing? You know, why am I doing what I'm doing? If it's causing me this much, exhaustion. And so sometimes it can be very depersonalized.
Yeah, I think, and to build off that too, I think, symptoms of burnout include sort of feeling of personal inadequacy and sort of general apathy, sort of lack of regard for maybe what you're doing, the care you're providing for patients, your interactions with your colleagues, and those sorts of things. And I think that there's a lot of factors that contribute to burnout. When we think about residents, there's sort of like a lot of issues surrounding lack of work-life balance and sort of the sense of being overworked, not having enough sleep. As a radiology attending, I think there's just a lot of pressure for, high volume, high acuity cases, sort of, potential to be isolated at work. And I think there's just a lot of negative sort of aggregate impact of all of these factors that kind of contribute to the burnout symptoms.
Yeah.
Go ahead.
I would just say, like Hannah's saying, this idea of losing self-efficacy or feeling like you have lost that is sort of that imposter component, feeling like you're not where you need to be with respect to the work that you're doing, whatever role you're in. And that can lead to a lot of distress on different levels, both sort of empathic distress and moral distress. I think a lot of us have felt that this year and a half, more so than perhaps in the past. And that can be compounded by pre-existing physical or mental illness that can only heighten the sense of exhaustion and cynicism.
I was just going to add, I think the pandemic has not helped the situation because we've all been very isolated. So that community of support that you might turn to if you're having difficulty finding meaning because you feel overworked or you don't feel valued for whatever reason, you don't have that same community. It's been very isolating for everybody. Many people have home workstations, which you would argue might actually improve your work-life balance, but in many ways, I think it's actually made it very challenging, particularly for people who have young children, where you're then not even able to sort of disconnect those two parts of your lives. At any moment, you're doing both of them simultaneously. So I think the pandemic actually made people feel more burned out potentially than even before. Burnout really has been a problem for quite some time. It's just, thankfully, we're now starting to talk about it and hopefully going to make some positive changes moving forward.
Mm-hmm. Yeah. So on the flip side, we talked about burnout and really you did a great job talking about the symptoms and burnout and just really breaking down the pieces to burnout. On the flip side, there's resiliency. And we talk a lot about resiliency, I think, particularly when now we're looking at radiology residency applicants or we're looking to hire. The resiliency factor is so important. So starting with Hannah, what do you feel is the definition of resilience?
Yeah, I think resilience is sort of the capacity to respond to stress in a healthy way, in a positive way, to sort of bounce back from a challenge or difficult situation in a way that you can sort of continue to grow stronger from the experience itself. I've heard Michael say that resilience is sort of like your grit. How gritty are you? How do you measure up that way?
Yeah. Anyone else like to add to that?
No, I think I totally agree. I think resilience is you're faced with adversity. What is your constitutional makeup that allows you to deal with that and makes you resilient? And it's, a lot of us say, well, you're just born with it. Well, no, some of it might have it inherent in themselves, but a lot of it, you can build upon it, and it just taking cue of environmental factors and going back to the basics, things that we're thankful for, things that will help us. Just self-care will help guide some of that and help build upon resiliency. So it's definitely something that just I notice in my coworkers that, I just can't handle the stressors like, Dr. X. But why is Dr. X able to handle it and you're not able to handle it? Let's go down and discover that. So I think that's very important.
Right, because I think I would definitely agree with what's been said, and I think it is learning how to, when you're facing a challenge or you've had a failure, for example, it's how you process that, and then you learn strategies how to sort of actually grow and learn from the situation, so that next time you're facing something similar, you're able to actually handle it and cope with it very, very well. I think a part of it's also, if you're resilient, you tend to have a much more optimistic attitude. Your glass is really half full, not half empty. And you see some of those challenges and setbacks that might shut you down in the past. Now you see them as actually as opportunities to grow and become stronger, and hopefully to also pass on your knowledge to other people coming up, so that they can hopefully not have to go through all that growth on their own. They can maybe grow through you, and be in a better place even when they start out their career.
Yeah, I guess I would add that one doesn't necessarily need to be optimistic to be resilient. It helps, certainly, but I think it's also just the way that one copes with the situation has a sense of sort of realism and preparedness, having dealt with similar situations in the past and built up ways to protect one's personal self and emotions from the negative effects of whatever it is that is causing the stress.
Absolutely. I think it's really interesting too, just anecdotally. I'm in, by strict definition, private practice, but affiliated with the University of Missouri, Kansas City Department of Radiology. So it's sort of a hybrid model, kind of similar to Dr. Ali. And especially last year during the virtual interview season, I noticed from the, first year I had participated in residency interviews at UMKC to the second year, which was a virtual component, that when we talked about our applicants, and I don't know if any of you had similar stories or situations, we really did talk about the resiliency factor. And I found that very, very interesting that was more of a topic during virtual interview season and COVID and all these things than ever before. So again, just highlighting, I think, the importance of burnout and of resiliency. So I want to switch gears a little bit. I'm really fortunate to have, Hannah here and Priscilla and Michael, because the three of you were involved in this really amazing paper that was published in May of 2021 in the JACR called Longitudinal Resilience and Burnout in Radiology Residents. So I want to talk a little bit about this manuscript first. So Hannah, you were the first author on the manuscript. Can you sort of talk us through about this manuscript and your results?
Yeah, so the purpose of what we were trying to do is to sort of determine the resiliency levels of radiology residents as they enter residency and sort of as they progress through residency, and similarly to investigate sort of changes in resiliency that might occur, and likewise with burnout. And so in order to do that, we used a couple of validated tools that are available for a small fee. Specifically for resilience, we use the Connor-Davidson Resiliency Scale. So it's a 25-item survey tool. It's been validated. And then for burnout, we use the Maslow Burnout Inventory, the Human Services Survey. Specifically, there's a bunch of different versions of that inventory, and that's a 22-question survey. And so, and that one sort of looks at three specific domains: emotional exhaustion, depersonalization, and personal accomplishment. With regards to that scale, the higher scores in the emotional exhaustion and depersonalization scale suggest that somebody may have symptoms of burnout, and higher scores in the personal accomplishment scale suggest a higher sense of personal accomplishment, maybe less, maybe more protective of burnout. The resiliency score is kind of just the higher the number, the more resilient. And so what we did is we surveyed residents over several years from 2013 to 2019. And we gave the surveys at various different time points during the year, sort of depending on how the year started and ended from 2016 to 2019. And so through these surveys, we tried to look at the longitudinal results of both burnout, resilience, and then the relationships between the two. So I can talk about the results if you're interested in that.
I am interested, unless Priscilla and Michael want to jump in.
Yeah. For resilience, just to start out with that one, so we had sort of variable response rates over the years of surveying. So it ranged from somewhere about 39% to about 87%, depending on what year of the survey it was. But overall, what we found through the surveying process was, in our fairly small sample size, there was no statistically significant difference between baseline resiliency scores between men and women residents. We did see, though, that there was statistically significant overall decrease in the resiliency scores among women compared with men over the course of residency. And then sort of post hoc analysis showed that the scores also differed significantly between men and women at years 3 and 4 of residency. Yeah, and so the graphic that just popped up there was showing sort of the resiliency plots for women and men, and probably the most important thing to kind of look at on those charts is the bold line, which is sort of like an estimated regression line representing a smoothed average of scores over time. So you can see there was started out at the same point, kind of dropped, but more significantly in women. So that was the findings for the resiliency side of things. On the burnout side of things, similarly, our response rates were about 35 to 87% over the rounds of surveying. We can talk about sort of the implications of that later if people are interested in that. But overall, we found that, interestingly, trainees do not enter diagnostic radiology residency experiencing frequent symptoms of burnout, which is kind of surprising because these people have just completed a fairly rigorous internship year. We also found that there was not a statistically significant temporal change among the burnout scores on any scale across subjects, so as they progressed through residency, or between women and men. But then if you looked at women individually, sort of as a cohort, there was a difference in scores in the depersonalization score between the first year and year 2, as well as between years 2 and 3. And by that, what happened is sort of things decreased. So burnout symptoms became more frequent. So that was sort of suggested that the women are experiencing an increase in frequency of depersonalization-related burnout symptoms during parts of radiology residency.
Yeah, when I read that, I was frankly not surprised, but I also, just to be real, I wasn't surprised. And I also, I found it disconcerting because I thought, gosh, if we're revealing data like this that is showing a statistically significant difference when it comes to women, what does that mean? And I, certainly don't want to get off on a tangent, but what does that mean for recruitment for women in the field? And we all already face quite a disadvantage in comparison to our male counterparts, where we're teeter-tottering around, anywhere from 27 to 29% women in the field of radiology. So that, I found very, very interesting. Priscilla, what did you feel, just from being a part of this manuscript? I mean, what was very telling to you?
Well, I mean, I guess there were a couple of things. As Hannah said, what I found fascinating is that there were no gender differences when people entered residency. The burnout, which we saw, I mean, yes, there wasn't a major difference, but I mean, people did feel more burned out during their call years when they're doing overnight call. And the one thing I think we do need to keep in mind is this study was done at one academic institution. So to me, yes, we saw some changes in that resilience, which does concern me that women are losing resilience over time. And that does worry me, as you've said, for recruitment, but also just for, longer term, women being in the field. This shows that we may have an issue that we need to really address or be able to support these women more effectively. But it was just very interesting to see sort of these changes that were taking place. And, as I said, I think it's good that people are not coming into radiology feeling burnt out. They didn't really leave feeling that burnt out, but this resiliency piece is actually very, very important. Mm-hmm. So I think within residency training, there's a real need to help people develop those skills, and particularly to help to develop them in women, sure. and try to also look at this. I mean, it definitely would be worth trying to repeat a similar study at other residency programs in different settings too, of different geographies and different smaller programs, larger programs, community-based, urban-based, to see, is this really a problem universally, or could this be just an issue that we're seeing at this one specific institution where the study took place?
Yeah, I think you make a great point, because full disclosure, I did my radiology residency at University of Kansas in Wichita, and Dr. Ali was my amazing program director. And I distinctly remember feeling very burnt out at the end of my intern year, and I distinctly remember having a conversation with him about that. I rebounded, resiliency, but see, I'm the definition of resiliency. But I remember having this conversation with him. So I think it would be really interesting if we were to look at this from multi-institutional standpoint, and as you talked about, Priscilla, small programs, medium, large size programs, geographical differences. I think we may see maybe something that slightly differs from your results, or maybe I'm just in the minority. I don't know. So
no, I think it would be very interesting to look at it. I mean, I definitely think it's worthy of further study, and I'm hopeful that other institutions will be, and programs will be interested in sort of addressing this and actually trying to follow residents over the course of their training to see, are there differences? And then obviously the next step is to figure out, how do you address those differences? Because, what are the things you can do to help build resiliency and help people function at a higher level, so they don't become burned out.
Mm-hmm.
Right. I think coming from a small program, I just anecdotally, experience for last 10, 15 years, I think our results would pretty much mirror some of the findings that you guys made. I don't have any statistical proof of that, but just from experience.
Basically, I mean, this was certainly a concern of mine as I was running this particular residency program. And, I was really fortunate to have Hannah. Hannah was my chief resident, who was very interested in this. And this is when we sort of delved into this whole topic in much greater depth. I mean, hopefully it's opened the conversation. I mean, we're having a conversation tonight, which is a positive thing.
Great. Yeah, I think it's important that we've identified that this is an issue, at least specifically in certain programs. Maybe it's not totally generalizable to every program, but at least it's sort of beginning the conversation, like you were saying, Priscilla and Amy, we didn't. From the study, we didn't figure out why people were experiencing more symptoms of burnout or why resiliency was decreasing. We weren't unfortunately able to get that information through this, but I think it's still just a really good place to start, so we can begin the conversation, look more deeply into this as a topic, try to figure out, is it something about radiology residency? Is it something about the sort of lack of a team-based structure that radiology is? It's kind of a one-person team approach sometimes. What is it that contributes to these changes, and then go from there. And definitely, I think looking at it in a broader scope is really important.
Absolutely.
I think one takeaway that I had on the resilience side, at least, was the protective effect of resilience, and the factor that was associated with sort of the protective effect and also protective from burnout was this sense of personal achievement. And I think that's just it could be really overlooked in a in a program, certainly as junior faculty, how much you've really accomplished just getting to that point in your career, and even focusing on the small wins during your training. I look back at my own residency in a community program in Philadelphia at Albert Einstein, and we worked really hard. We had like high volumes. We took crazy call overnight. I mean, it was intense, but we were all really happy. And I think part of that was that we were like deeply engaged in the learning, and we got a lot of feedback about like the strengths that we were building in radiology from our faculty, and having that as a sense of personal achievement, right? Like knowing how to interpret these different types of challenging scans and being able to perform them on our own. And I feel like that did a tremendous amount to build confidence and give us a really positive attitude and resilience going into these challenging situations moving forward, certainly into fellowship and beyond. That has really stuck with me.
Yeah. That kind of resonates with me, being, as Dr. Ali recalls, like we were a smaller community-based program, but we were such a tight-knit group, and we didn't have fellows. We kind of, similar to you, Michael, we were working our tails off, but we felt a sense of accomplishment that we could do so much. And then Dr. Ali appointed me social chair, so we had a lot of wellness activities. And we would get together quite a bit outside of work and make that a priority. And Dr. Ali made sure we had secured funding for that. And so I feel like just all of those things and working together as a team and having that camaraderie, both during that the day-to-day work day, but also outside of that, I think that in and of itself was quite an achievement, and really helped us in times of strife, and really helped in terms of resiliency.
No, I agree. I mean, I appointed Amy because she was so introverted. I thought maybe giving her that but no, I 100% agree. And Michael, what you said was very interesting, because what I'm just thinking about it. In my first years, there's so much to learn, so much to grasp, and they're just like, oh man, I don't take call, but still this is very overwhelming to me. And they don't get that personal sense of accomplishment. And when it hits them, for my residents, it's after their first night float, actually. Mm-hmm. They've been alone, they've had the opportunity to interact and with the ER physicians, make some calls, and they're like, okay, I'm finally doing something. I'm finally getting engaged in the clinical environment, helping to make decisions, and things just start sinking in. I don't know, you get some of you, Hannah, Amy, Michael, you guys were residents not too long ago, but I don't know. I think that's when they really get it, and actually they feel a sense of accomplishment. I think that's when the resiliency starts building.
Yeah. I mean, I also think it's as simple as like an attending giving you some positive feedback about, how you interpret something, right? That goes a tremendously long way in building self-confidence. And I feel like I'll admit, like we probably don't do that enough. And so I feel like that's just one easy takeaway that, maybe I'll take to the reading room tomorrow to help build resilience in whoever I'm working with.
The other thing I've done as a program director, which I think is very important, is particularly for the first year residents, it is a tough year. They're on rotation every month, a different place. They start from scratch every time. They get up to a reasonable level, and all of a sudden they're back to square one again. And it's this up and down roller coaster that is actually very, very hard for people to understand. And if they're experiencing it and not prepared to expect it every month, I think it's actually really important to really connect with the first years and make sure they're aware that this is how the year is. This is normal. It has nothing to do with you. It has to do with this is how we learn radiology, and that you're going to have these ups and downs, and it is absolutely everybody in your class is experiencing it, and everybody ahead of you has already experienced it, and this is okay. This is normal, and I think it helps when people know what to expect. They're much less likely to feel burnt out, because they know, okay, I'm going to start from nowhere or very low level, get up to a reasonable level, then back to the square one again for a different area. And, by the time, what I find with our residents, by the time they finish their first year and they have the new first years coming in and they're now second years, all of a sudden they realize how much they actually know and how much they've accomplished. So, and I would also agree with what Amy said. I think the social aspect is very, very important. Part of what Hannah did when she was a chief is we didn't actually measure any of this, but we kept polling people or surveying our residents on what activities did they want to do. We tried a whole range of activities: escape rooms, trampoline parks, just out for drinks, apple picking, lunches right at the hospital. Yeah. And what was fascinating is that people just want to get together, and more people want to get together during the workday. So for us, lunches and food providing food during the day where people could just gather was actually probably the most effective use of our funds. And it really built that sense of camaraderie, which I think is also critical. And then we also ran a whole sort of small group professionalism ethics kind of curriculum, part of which where we discussed some issues that would be definitely related to burnout and resiliency in sort of with scenarios. And those discussions, I think, were very helpful, where people really were sharing their personal experiences and things that they had encountered and how they dealt with them, or maybe they didn't deal with them correctly or well the first time. And I think that sharing of experiences was also very, very helpful and made everybody in the room realize that they were not alone. Because I think that's the other thing. You want that sense of community. You want to know that what's happening or what you're feeling is normal. And that validation sometimes can also help, I think, avert burnout and also make you more resilient.
Absolutely.
Yes. Certainly piggybacking on what you've just said, Priscilla, a couple of years, it's been 3 years now, we actually started a wellness cup at our program. So it's a competition between the attendings and the residents where we have 5 events. Like last month we did pickleball. So we all went out. It's just for a chance for the attendings and residents, so they know, oh man, Dr. X is kind of a cool guy, or Dr. Y. No, he's as boring as I thought he'd be. But we have different events, and some are over the noon hour. Last year we did a ACR escape room over the noon hour, and we just make it kind of competitive and fun, where it's pitting the attendings against the residents, and then at graduation, we hand out the wellness cup to whichever side wins, the residents or the attendings. The residents have been winning, so the attendings are fired up this year to get it back.
Man, I wish that you had that when I was in residency.
I know.
So cool. This is a cool program, guys. I had a great education.
I want to go back to residency. That one sounds fun. I like this.
Yeah.
So I wanted to shift gears a little bit. Specifically, I find it fascinating, particularly with Michael's background. Not only is he a chief of breast imaging and a very amazing breast radiologist and educator, but he also has a coaching hat. So I wanted him to sort of discuss that. It's such a unique thing, I think, in medicine in general. And just from what we've discussed, and kind of to piggyback on that, what we discussed this evening, Michael, just from wearing that coaching hat, what conversations do you think that we need to have, given that you have experience in this role?
Thanks, Amy. So I guess I would just say that coaching is just one mechanism to use, one tool to use in this approach to help people who may be suffering from burnout or moving in that direction, or even to help those who are doing just fine, but help them, achieve greater heights. It's really a tool for self-reflection and engagement to focus on growth. And that's really what it's all about. And so, we all have opportunities for growth, even though we're all very successful in whatever it is that we're doing. And I think the nice thing about coaching is that it's done in a confidential way. It's done generally between a coach and one other person, although it can be done in group settings too. And it's really about that relationship and really about sort of delving into what motivates you, what goals you want to set for yourself, and working to better yourself in some way, whether that's professional or personal, and helping you focus on, creating the change that you want for yourself.
So how did you get into this?
So I guess the short story is that where do I begin? The short story is that I was at Beth Israel working with Hannah and Priscilla, and at the time I was sort of dabbling in the non-interpretive skills, things like different topics in psychology, such as resilience, for my own interest, and trying to impart the little that I knew to the residents, because I thought that they were important skills for us to learn about that impact how we communicate with each other and with patients, so that we could become better physicians. And through that, I was introduced to the wife of one of the residents, later chief resident, Melissa Maris, who was a coach. And she introduced me to the world of coaching and really opened my eyes to the benefits of what coaching could offer individuals and sort of people in different settings. And so through that, when I switched jobs to my current job, I asked to have coaching for myself and to get trained as a coach, because I was already very interested in learning more about those skills and being able to provide that skill set to those around me. And as it turns out, the coach that I used was a fellow radiologist, Dave Fessel at University of Michigan, who I'd met at the ACR conference about 6 or 7 years ago now. And he had mentioned this to me in passing as we were sitting at a change management session, that he was a coach. I had no idea what he was talking about at the time, and I just kind of filed that in the back of my mind. But when I was thinking about who I wanted to ask to be a coach, I thought, oh, wait, I think I met this guy at the ACR conference once. And so I really have the ACR to thank for helping get me on the road to coaching.
Amazing.
And Dave was and is an amazing coach and human being. So I have a lot to be thankful for from that respect.
Wow, that is amazing. I think more programs should be using the two of you to, just to be honest, I think it's fascinating, and that, there's not very many of you out there. So kudos to you for taking it to the next level and truly caring so much. I mean, for you, it started from, you had an interest, and then you imparted your wisdom to the trainees. And so, kudos to you to want to, help others. So I find that very commendable.
Michael, I do have one question. How do you implement this in your program? Do you do one-on-one sessions with the residents?
Yeah. So that's a great question. So what I tried to do, although we're in the process of looking at the outcomes data, what we tried to do was build off of a program that was developed at Mass General in Boston with general internal medicine and other sort of primary care specialties, where they implemented a coaching program and offered it in a sort of randomized way to the residents in those programs. So what we did in our department is half of the residents would receive coaching on a quarterly basis, and the other half would just get whatever run-of-the-mill mentorship they were getting. And we were giving them surveys at baseline and at 6-month intervals to look at the impact of coaching, and also at other impacts on things like burnout and resilience and quality of life, et cetera, and engagement. So we're in the process of reviewing the 1-year data at this point. I think one of the challenges, just without even having reviewed all the data, is that the response rate is pretty low. It was a challenging year to implement a program last year. And I think in general, similar to these results that we presented tonight, the response rate is often challenging when you have a long list of questions and tools that you want to assess a group of people. So what I'm hoping to transition to is just to provide these coaching services on an as-needed basis to both trainees and any faculty in the department that is interested in utilizing them at any point for different reasons. They certainly can be used both for growth, but they also can be used in different settings. I've seen in medical education in terms of remediation coaching for people who have some interpersonal challenge or have failed a course or going through a tough time, to have coaching during that as well.
Amazing. Thank you for sharing that with us. So I want to shift gears now. We've spent a lot of time talking about the world of academics, but now I want to transition a little bit to private practice. And so, Dr. Ali, although you are involved in it with a residency program, are you still the president of your private practice group? Are you still? Oh my gosh, you are a rock star. So Dr. Ali, in addition to being the program director, he is the president of Wichita Radiological Group. And what are some wellness initiatives or anything in regards to wellness that specifically your partners, your practice has looked at or maybe implemented?
I think that's a very important question, because once we make our way from residency, now we go into the real world where we spend the majority, 20, 30 years or what have you. So a lot of private practice these days, still some of the old guard, right? None of us were taught burnout, wellness, resiliency training when we were in residency. That non-interpretive skills was not a big thing. And so a lot of those attitudes shifted over into practice. So first thing is, we got to realize that this really exists, guys, so that was the biggest challenge, I think, to me, is when I say, this is a big topic in radiology, in residency, in our training, but what about amongst our faculty, and we had a lot of faculty, which I'd say experienced faculty, 15, 20 years out in the real world. And then some of the younger faculty were coming on board. And I guys at a faculty meeting, I said, we need to discuss this. It's a real topic. First thing is open conversation about it. I said, why are we discussing this? When we were residents, we just sucked it up and kept going. These are, you probably had some sort of burnout. You probably had some sort of depersonalization, but you're not willing to talk about it at that time. So this is a time. So we did have this open conversation at our faculty meeting and talked about burnout, talked about what some of the things. So, the only construct I had was what's going on in the radiology residency world, training world. So we opened that discussion up, and, as I expected, some were totally tuned out, and others were like, okay, I feel that. And some of the stressors that I have at work, it's not just stressors at work, it's in my personal life and some self-care issues that I haven't really attended to, but I'm glad that somebody's here listening and talking about it. And so, that's the first step, is engage in dialogue. And then you take baby steps from there, and I think, and the other thing is that make it an inviting experience. At that time, parental leave was a big hot topic. Amy knows, because she brought me at the ACR and we talked to people that were involved in it. And, I said, what are some steps that we can take as an organization to show that we do care about people and about their personal well-being? And, I can't change the whole world in one day, but, do we have a leave policy in place that's even somewhat remotely would be attractive to anybody that's wanting to come and join us, whether it be male or female? And that's the first thing that we say as a group. We can work on a parental leave policy. And that's when, I'm happy to say our group came up with 12 weeks paid leave for family leave. And we're very proud of that accomplishment, although we had a lot of naysayers at the time, but we worked on it. The other thing that you need to do is that, we can keep talking about it at faculty meetings, but you really need a champion, somebody who really wants to take charge of it. Fortunately, our Dr. Kicho was very much for this and really got invested in it. That's why I was going to refer her to Michael after this and see how she can be a coach. But, she took on the lead to develop the curriculum for our residents. And for the faculty, she's in charge every faculty meeting to come up and talk about wellness initiatives that are going on in the community, about self-care, relying on the ACR wellness curriculum, well-being curriculum that's out there. And she helps. And every little bit, just talking about it, I think really is helpful. For some of the things we did during the pandemic, I think we were socially isolated and we started reading from home. while some of the time, I wouldn't want to do it every day, and none of us wants to do it every day, but once in a while it became really popular. So now we have one shift where somebody's working from home and they're like, wow, I can see my kids as they come home from school, talk with them for a couple of minutes as they go off into practice or whatever, which I might not be able to get involved with, but at least I've had that opportunity to do that. Others, the other big part is that patient care is just not about us as radiologists and as our trainees, but it's also all the non-physician providers we have working with us, the technologists, the schedulers. So that Dr. Keach has done a great job taking on that wellness initiatives with them. We've come up with appreciation boards. If you found somebody helpful, write it up on a board. Photo boards, tell us something about yourself so we get to know one another. And being grateful is another big project of hers, so we've come up with Thankful Thursdays now. At Cypress, we have a women's imaging center and a freestanding imaging center where we employ the staff. So whenever we, as physicians, when we see something, just like we do for our residents, give them attaboy, attagirl, and give them some positive reinforcement. We do the same with the technologists. But instead, you did great. I'm so happy that you're able to schedule this patient for her biopsy today, even though we're like chock full of exams. So we have a little goodie bag with the Starbucks gift certificate, some candy that we just hand out, something tangible that they can say, wow, I feel appreciated. And for our attendings, our work environment's poor. We're always sitting on the desk. So now every desk in the department has, those desks which can elevate and you can move. And we've, one of our residents is doing a quality improvement project on eye strain and putting up ambient lighting and looking at those things that can both improve stressors in the workplace, and that can also, when you go home at the end of the day, you said, my job meant something. I helped somebody. I was part of a team. So those are some things that definitely didn't start off on the right foot, but through constant communications, constant talking, I think we're headed in a direction which we can be proud of.
Yeah, absolutely. I think that's great that you've been able to implement so many measures and that the faculty, your partners, are talking about this. And, I'm fortunate to be in a practice where the radiologists, my partners, really place an emphasis on work-life balance and work-life integration, as we call it now more these days. And that was an appealing, part of, why I, ended up joining this practice. And the things that we do for just for our technologists, we do similar things to what you do in terms of giving them a kudos. We the way to people's hearts are through their stomach. We regularly feed our technologists, feed our staff. I tend to, in our breast center, feed everyone once a month, and they get to pick what they want. And so little things like that, I think, can make a huge difference and can really promote that camaraderie and just taking a break and just kind of, it's a small period of time, but just kind of focusing and on each other and recharging. But I know that, and I think you can all probably attest to, and Michael, you used to be in private practice. Unfortunately, that is not the reality for, to be honest, the majority of private practices, I think, in this country. I think we're under a lot of pressure to produce volumes, whether you're RVU based. And so there may not be as much of an emphasis placed. So I think that's why tonight, having this discussion, talking about it is important. And for people to see us engaged in this, and if they watch this tonight, know they have people that they can reach out to if they want to spur change in their practices. So, Michael, any anecdotal experience or information just from when you were in private practice in regards to this topic? Any initiatives perhaps that you implemented as a practice or didn't and wish you would have liked to see?
Yeah, I certainly, I would say that at the time, as I mentioned, I didn't even really know what burnout was. And even though I was kind of experiencing it to some degree, and it really wasn't due to the group. I thought the group that I worked at is a fantastic group, still is a tremendously strong private practice group, Commonwealth Radiology outside of Boston. And I think the factors that were impacting me more than anything were really just the commuting time and how that impacted me when I showed up at home at the end of the day, and my mood, and knowing that that wasn't going to be a sustainable solution as a lifestyle choice for me. But I think what the group really succeeded at was the leadership was very engaged, and every member of the group, whether you were a partner or on the partnership track, you had a voice, and it was a safe place to speak up your personal opinions. And so I think creating that sense of psychological safety was critical to building the strength of the group, and also the fact that people in the group the group was just very transparent, and everyone was treated very fairly. And I think that just bred a culture that was very positive in the group. So there may not have been, quote unquote, wellness activities happening at the time, but I think the culture that existed and continues to exist, from what I understand, was a very tight-knit, positive culture, similar to what Dr. Ali was sharing. And I think that went a long way in fostering well-being in many respects, not perhaps across the board, but in many respects.
And I would agree. I mean, I think the culture is really set by the leadership. I mean, part of it's set by the practice or institution, but whether it's private practice or an academic institution, the leader really can set that tone. And, I mean, the other things in addition to what's already been mentioned is I do think, one thing that practices and leaders can do is to help hopefully create more flexibility with the work schedule for, people at different points in their career. One of the things I saw that was remarkable where I currently am at Boston University is during this pandemic, the women radiologists and even technologists who had young children, the department was extremely flexible with their work schedules and let them cut back appropriately. So, they wanted to retain them. It showed that they really cared and respected these people and wanted them to stay in these positions. And so they were extremely flexible on the work shifts that these individuals were going to be doing during the time of the pandemic when their children were at home getting homeschooled or, signing in virtually for school. So I think that was really, and I do think this element of gratitude is actually very, very important. And I mean, the other thing that I always try to do is every day to do something, sort of, be kind is my sort of motto. Kindness goes a long, long way. Doing something nice for somebody every day. Maybe it's somebody who you're working with directly. Maybe it's somebody in a different, section in the department that you may not even interact with that often. But, showing that kindness, I think every day can really build that camaraderie and make it a much more pleasant work environment for everybody.
Yeah, along the lines of kindness, I think celebrating people's successes is really an important thing too. If someone's giving a neat talk or got something published, there are a lot of like small gestures to celebrate successes. And I think that by doing so, you also sort of help people continue to cultivate their passions and realize and discover what those might be, because it's that little positive feedback loop. So I think that that's really helpful. I've never worked in private practice, but I think for anybody anywhere, those kinds of things really kind of help people feel valued beyond just getting through and reading the studies.
Yeah. Well, that leads me in beautifully to the next sort of question I had for all of you, sort of open for anyone to answer. So we are talking about changes at the organizational level, and, particularly as Priscilla pointed out, it really starts at the leadership level. I mean, what if what if you are somebody watching, and regardless of whether you're in private practice or academics, you're at a practice that you have, frankly, the leadership may not be buying into this, and changes at the organizational level when it comes to burnout. Where do these radiologists go from here? I mean, where can they start to try to initiate change?
I mean, I think you can always start with yourself, right? I think that's one thing I've learned in coaching, certainly, is that, you can change what you can change. You're not going to necessarily be able to change everything around you, but you can make choices for yourself, even in the setting that may not be optimal, to make your own life a little bit better, and to craft what you're doing, hopefully to have it be more productive, more enjoyable, and more fulfilling. So I think, asking yourself, what's in my control, what's not in my control, and what am I really most passionate about, and what am I engaged in, what drives me, and trying to, focus on that a little bit and think about ways that you can do more of what is really important to you, that is in your control.
Right. And I think that's where coaching actually can be very, very helpful, because I think if you are in an environment where the culture is not one that is, at least addressing burnout, and you see that as something that's important, sometimes actually having a coach, I think, would help you sort that out. And as Michael says, you'll identify what you can change or potentially can change. And the coaching might also help you realize that maybe this environment's not right for you.
Yeah.
And that you need to make a change in your career. You may need to move practices or institutions, or pursue some other avenue, because if you care enough about yourself, which hopefully you do, you'd be willing to make those changes if necessary. But sometimes it's amazing if you figure all that out. It's possible you could go to that leader, or you could go to leaders in the organization and express your concern, and maybe they'll be responsive. But certainly you want to try to make the environment work, particularly if you're happy with all other aspects of the job.
Yeah, I think like Dr. Ali was sort of referring to, having a champion, someone who really believes in this cause, as someone to work with is probably a great first step if you're seeing these trends, in your practice, your organization, and kind of, I think, taking baby steps, like you were referring to, Dr. Ali, with the parental leave. That's a low hanging fruit. That could be a first step towards increasing wellness, and trying to sort of leverage some benefits like that, and kind of working from there, and sort of socializing the concepts of wellness and burnout as important things to discuss. Right. And then hopefully building off of that to make change.
I think all of those points are very well said. I think introspection is a big part of it. Wow, what motivates me? What gives me passion for what I do? I want to take care of patients. I want to be the best radiologist I can be. But it is, what can I first fix about myself to get into a place where I'm happy, where I'm not feeling exhausted and not depersonalized? Maybe having the courage to go up to the leaders and say, hey, can we just talk about this at a group meeting? Maybe just open up. I'd be happy to lead the conversation. And, if you're, as a president, if you're too scared to bring it or don't feel comfortable talking about it, I can lead the conversation, and we just see. And maybe we'll find out that nobody else really cares about change. Nobody else really feels like I do. And then at that point, I have to realize it's a risk reward thing, right? Is this the right practice for me at that point? If everything I'm trying to do and I'm still not happy, how much do I really want to live in Wichita? I'm just speaking on Wichita. I know it's not the ideal place for everybody, but am I willing to move and things like that? And those really come into play. But at first, I give it a shot and go up to the leadership and say, hey, let's at least have a conversation about it.
And I was thinking, even if you end up moving, it's not that you failed. And that's right. It's not a failure.
Absolutely.
On the part. I'm a firm believer that many of us come to cultural environments differently, and so certain environments may be very beneficial for one individual, but could be very toxic for others, because you have different priorities, different values, different things that motivate you. So it's a lot, as you said, introspection, and then finding a position or a job that fits you as well as everything you're hoping to accomplish. And it's out there, and it just takes time sometimes to find that right fit.
Absolutely. So we're rounding the hour, and in conclusion, I want to go around before we close the hour, and if there's one takeaway that each of you can impart tonight, what would that be? So let's start with Priscilla.
I think the one takeaway I would say is that the most important thing is to know yourself, and to always pursue what you're most passionate about, and make sure that you're always happy and you're doing things that are aligned with your priorities.
Wonderful. Hannah.
I think, you know, when we're kind of thinking about wellness and how we want our practices to sort of look in the future, I think it's really important to practice inclusivity and make sure that we're including, you know, all different types of people, men, women, across the board, to just really kind of build a stronger radiology workforce.
Wonderful. Kamran.
All right. Well, I think introspection is a big part of it. I think as leaders, since you know, I've been in leadership positions, inclusivity is very, very important. Making people feel engaged, feeling they're part of their group's mission, creating a culture where you care about each other on a personal level, not just about productivity.
And Michael.
I would just say that, you know, we started this conversation talking about burnout, and I would like to again mention that, you know, this past year has been incredibly stressful in ways that we could not have imagined, and still many of us don't feel comfortable talking about, and has had tremendous impacts on physical health, on mental health. And I think that if nothing else, I think I've thought a lot about that this past year and for my own mental health. And I think it's important to just be able to take care of yourself first, because we're not going to be able to take care of others around us if we can't do that. And so seek help if you need it, whether it's from your program director, from your chairperson, from a trusted colleague, from a coach, from a mental health provider. It's always important to identify who you can turn to for help, and to be able to talk to somebody in confidence. And go Ravens.
You had to do that. Well, that was and on that note, thank you everyone for joining us tonight for the second rendition of the JACR Virtual Journal Club. Thank you to our esteemed panelists this evening, and we'll see you next time. Thank you.
Bye.
Thank you.
Take care.
Bye-bye.